Effective verbal communication features interaction and some simple structure and patterns. Whether for routine handovers or urgent communication, these principles are important. They include proper identification of the patient, concise and relevant detail to help the receiver, and the opportunity for the receiver to ask and answer questions. Look for these patterns in the next videos.
Hey Helen, it's Damien here. I've got Mary Clement to send up to you. She's 53 years old. She's living at her own home. She had a fall to her hip there. She's going to be admitted under the hospital service because her GP doesn't have any privileges here. Fall was today about 5 o'clock. She came in by a BC ambulance. Big bruise there, nothing on x-ray in terms of a fracture. They're trying to rule out a stroke. That's part of the reason for the admission as well. And she's a type 2 diabetic, insulin dependent as well. Vital signs are actually pretty good. Her pain is a chief problem. It's 7 out of 10. I'm going to give her some analgesic. Right now her blood sugar is about 6.7. She's sitting well on room air and her neurostatus is intact. She didn't hit her head or anything like that. So as I was saying, the analgesic, I'm going to give her about 4 milligrams of morphine that's being ordered, and then I'm going to call the porter and send her up to you. Okay?
Oh, okay, thanks. We're a little busy just now on handover. Do you think you could send her about 7:15? That way I'll be able to give a report to the next shift.
Yeah, sure, I'll do that. So I expect her probably around 7:30 then.
Okay, great, thanks.
Okay, thank you.
Hi, Dr. Rob.
Hello.
Hi, Dr. Rob. It's Jody on 3 West. I have an urgent message for you. Are you ready?
Yes, I am. Go ahead, Jody.
Okay, I have a patient that's desatting. It's a lady, she's 85% right now on room air with a respirate of only 7. She is a 50-year-old lady. Her name is Mary Clement. She came in under Dr. Verister, having had a fall at home. No fracture on x-ray, but she has some severe bruising. She's also an insulin-dependent diabetic. She came up from Emerge about 7 o'clock tonight, and on arrival she was alert and orientated and just sort of painful, like 9 out of 10 pain in her hip. She had some morphine in Emerge. Right now she's really drowsy, hard to rouse, her pupils are equal but constricted. I don't think that she's having a stroke, but she did get the 4 milligrams of morphine at 7 p.m. in Emerge, and she is only 90 pounds. So I'm wondering if she's had too much morphine, and I would like you to perhaps give me an order to reverse the opiates, and I'd really like you to come and reassess her. And then I'm wondering, if we do that, is she going to be very painful before you get here, or should I do anything about that?
Thanks, Jody. Go ahead and give her 0.4 milligrams of Narcan now. Make sure she's got a peripheral line. Call RT, and if needed, CCOT. I'm on my way to see her. I should be there about 30 minutes, and do call me in between if she deteriorates, and I'll reassess her pain management when I see her myself.
Okay, so 0.4 milligrams of Narcan now.
Yes, that's correct.
Great, thank you very much.
Thank you.
See you soon.
Hey Mark, I wanted to tell you about one of the new admissions that came in overnight, Mrs. Clement.
Yeah, I know a little bit about it.
Okay, she's 53. She came from home. She had a fall at home. No fractures on her x-ray, but she did have a lot of bruising, so she's got pain when she's moving. She does have also type 2 diabetes, so she's on insulin. But last night I think she got a little too much morphine. Her rest rate was down last night around 7, and she was desatting. I got a call from the nurse. She got Narcan, she did okay, but I think from here on, pain control is going to be an issue, decreased mobility, and maybe you can just follow up on her diabetes control as well.
Sure, sounds good. Anything else I should watch for?
No, I think she should be good to go once she's safely ambulating, so maybe get discharge planning involved with her as soon as possible.
Sounds good. Okay, thanks a lot. We'll look after her. Thanks. Hi Helen, just phoning you about Mrs. Clement, who we're trying to get home in the next couple of days. Do you have a second?
Oh, sure, go ahead.
So you may know her or may not, but she's a 53-year-old who came in, had a fall at home, and bruised her hip. She didn't fracture anything, and she's done pretty well. She's a diabetic, but she's just going to need a little bit of help ambulating at home.
I can start organising a discharge, and I'll get physio to assess her. I don't know her very well. I've been away for a few days, so I'll find out from them where she's at, and if she's ready to go, we'll get her discharge teaching plan together and get her on her way.
I'm going to give her a prescription for some pain medication, so just mind to keep an eye on her bowels, I guess,
Okay, great. Yeah, I'll make sure that that's passed on when she's discharged. Thanks.
Great, that's good. Thank you.
Bye.
Well, I'm just saying that, I notice it all the time here in the hospital here in Kelowna, that the nurses are spending time taking handover. You hear them sitting down on the phone, their phone goes, they're talking to someone and they're saying, do you have time for handover? And then they go through, obviously, a checklist. And, you notice it's very noticeable in the hospital, people handing over and spending time and then asking questions. And absolutely, I think I can say that it's more noticeable recently, yeah.
Effective verbal communication features interaction and some simple structure or patterns. The following clinical practice guidelines and iLearn modules may be useful to support your effective communication. Thank you very much to the nurses and physicians at Kelowna General Hospital for helping to create this video.